Fantastic. Well, welcome everyone. This is our first webinar of the year for the African Community of Practice. It's the first of a webinar series, so we will be having follow-up webinars throughout the course of the next few months. And as I've mentioned, this is hosted by the African Urban Health Community of Practice of the International Society of Urban Health. And this today's theme, we'll be speaking about Africa's urban health data, so specifically around strategy, scope, and innovations. And we've got a wonderful panel of presenters here today. Welcome everyone. We are about to begin the presentations, but before I do so, I just wanted to thank the steering committee of the Community of Practice. I've got a slide just showing everyone who is currently part of the steering committee, and you might know or have met a few of them before, but we are also supported by two fantastic volunteers who are supporting the comms and the admin and the events. And so Philip particularly will be handling a lot of the admin behind the scenes, so just thank you so much to him. And if you have never come across the African Community of Practice before, I just thought I'd give a little bit of an overview to what we are currently doing. We are basically a group of not only academics, but also representatives from government, from practice, and even the private sector, and we work together towards finding opportunities to exchange knowledge, best practices, and any sort of training possibilities around citizen science. And we are often involved in setting up workshops for certain conferences, and so we do hope to make an appearance at a conference one day around urban health that you might be at. But we do have, so keep a lookout, we do have a newsletter and an opportunity to sign up. So if you would like to stay in touch with the African Community of Practice for Urban Health, you're welcome to scan the QR code, and we'll also display this at the end, and yeah, you can be in touch. So this is a collaborative community. We will be having a short questions and answers and discussion section at the end. So we do hope you stay around for that. And yeah, we just want to thank you for being here today. And so I'm just going to stop sharing because then we'll just go into our first presentation. So I just want to welcome our panel of presenters with us today. We've got Jose Siri. He's an urban health consultant for the WHO, so he'll be speaking about some of the work they've been doing. And then this will be followed by Dr. Lambert Tata, who will be from the University of Cambridge, and speak about some of the work around the urban health data cataloging. And then we'll be speaking to the UN Habitat. It's Christelle, who will be representing UN Habitat's sort of headquarters on their program that they currently have on Young Gamechangers initiative. And then we have two representatives from UN Habitat Senegal who will be speaking about the actual on-the-ground data collection and digitalization platforms that they have. So very excited for such a wonderful spread of presenters. So thank you very much. So Jose, without any further ado, we'll hand over to you.
Great, thanks, Amy. Can you see the slide?
Yes, we can. Yes, perfect. All good.
Fantastic. So good morning. Thanks, Amy and the community for having me. I'm really grateful to be part of this conversation, this Africa-led conversation. It's good to see some familiar faces. And I'm going to share a few reflections from WHO's recent work on strategic approaches to urban health, including on data and evidence. So I look forward to your thoughts and your feedback on this. We are at a critical moment for urban health, perhaps especially in Africa, where populations are growing faster than anywhere else. There's been tremendous progress. On average, urban dwellers are healthier than rural, but we know that these gains haven't been shared equally. And there's room to improve urban health almost everywhere. So for example, virtually every urban dweller breathes polluted air. Around 700 million still lack improved sanitation. More than 1 billion live in slums or informal settlements. Many cities feature staggering health disparities across neighborhoods, income levels, population groups, and so on and so forth. You see other examples here. Urban dwellers obviously still face persistent health challenges, even though we know a lot about what works. Why is this the case? It's partly about a lack of resources, partly about competing priorities, but it's also about approaches that aren't suited to the complexity of urban health today. Now, this matters because urban health will only get more complex in the years to come. In Africa, as in the rest of the world, we're likely to see tighter resource constraints, more scarcity, intensifying climate impacts, greater variability, rising migration flows, new unpredictable impacts from emerging technologies, probably increasing geopolitical uncertainty, and other factors. So a time that's going to be more complex and with more uncertainty. These trends won't play out the same way everywhere, but overall we're shifting from a more stable, predictable past to a less predictable future. If we want to meet the needs of urban dwellers both today and tomorrow, we need to think and act more strategically. And that's the motivation behind WHO's new Guide to Urban Health Strategy. It will offer a set of principles and recommendations to support decision makers in taking a more strategic approach. And I want to walk you just through a few of its main ideas. Now, first of all, what do we actually mean by a strategic approach? We can take an example from sports or from games. When you coach a football team or play a game of chess, you don't just focus on the next move. You build your actions into a larger strategy that's designed to win. You think about the whole board, or the whole pitch, your strengths and weaknesses, your opponent's tactics, how your players or pieces depend on one another, how one move sets up the next move. Imagine trying to win a football match by only coaching the goalkeeper, or always playing the move with the largest immediate impact. You wouldn't win very much. Sometimes we approach urban health that way. We focus on a single sector or actor or a single disease or population group without considering the full picture. We don't always ask how today's moves constrain or amplify other possibilities or how they'll shape tomorrow's conditions. We may not consider how other actors and systems will respond to the things that we're doing. Now, of course, this analogy only goes so far. Urban health isn't a simple game. It's thousands of overlapping moves by actors with their own priorities, rules, and timing. Still, the core principles of strategic action hold. Strategy requires thinking beyond individual moves. The guide seeks to support a shift from tactical actions to the kind of coordinated long-range strategy we need to achieve the highest levels of urban health. Now, based on that framing, we identified 8 core characteristics of strategic action in a series of policy briefs last year. I won't read these out, but if you want more information, more detail, I'd encourage you to check out the linked policy brief. There are 3 others that you can also access there. Now, these aren't new concepts. If you've worked with health promotion or healthy cities or health in all policies, all of these things will be familiar to you. What's new here is the effort to position them as a coherent set of criteria to support the design, implementation, and evaluation of strategic action. Now, the guide will aim to turn these principles into actionable guidance. It will review the definition, scope, and boundaries of urban health, lay out the case for action. It will link urban health to major policy issues driving decisions everywhere, issues like demographic change, climate change, sustainable development. And building on that foundation, it will offer a set of structured recommendations grouped around 4 pillars of action, dealing more explicitly with complexity, identifying and developing entry points for action, strengthening the means of implementation to support sectoral interventions and multi-sectoral interventions, and developing formal strategies to guide coordinated action. I won't go into every detail, but I at least want to touch on each of these pillars briefly. Now, first, the guide calls for a more explicit approach to complexity. Complexity is a defining feature of urban areas. It arises from the ongoing interactions among stakeholders, institutions, policies, and environments. It shapes urban health outcomes every day. When new roads create more rather than less traffic congestion, you see complexity at work. The same thing when gentrification displaces people from improved neighborhoods, or when the successful reduction of a health threat leads to less funding. We can all think of promising interventions that failed in implementation. These situations often reflect unseen complexity. In complex systems like cities, linear thinking doesn't produce optimal results. Cause and effect aren't always direct. Solving one problem may create another. So urban health demands systems thinking, and that's central to frameworks like health and all policies, and it's been pointed out for decades in the context of urban health. But practice mostly hasn't shifted to meet this need. Urban health authorities are rarely trained in systems thinking. Data systems may not capture the dynamics that matter. Governance is typically still siloed and often has limited scope for adaptation. If we want to act strategically, we have to tangle with complexity. The second pillar of recommendations is about finding and developing entry points. Urban health may already be a top political priority in some places, but more often than not, it's competing for attention in a crowded policy landscape. An entry point is an open door. It's a favorable situation where political interest, public attention, or institutional alignment creates an opportunity to introduce urban health through other pathways. Once that door is open, concrete programs and policies can help an initial foothold expand or evolve into a solid foundation for a longer-term strategy. And because urban health is linked to almost every dimension of urban life, I should say every dimension, not almost, entry points can take many forms. You can find them in high visibility cross-cutting issues like poverty reduction or climate resilience. They can emerge from moments of disruption, a pandemic, or a disaster, a budget cycle, a major event that attracts global focus, or they can arise from existing cross-cutting programs and policies, a migration strategy, a heat action plan, a smart city initiative. The key is to uncover opportunities by making urban health more visible in the policy and political discourses that are already underway, and then leveraging those opportunities. The third pillar of recommendations is around the means of implementation for urban health, the systems and structures that support and underlie all other actions. And we've identified 8 important categories, which you see here. Yet again, these should all be familiar from prior guidance. The point is that even with strong political will, even with a mandate to act, real progress on urban health is unlikely if any of these are weak or otherwise deficient. So when we talk about safe streets or quality housing or universal health coverage or air quality or any of the other things that we talk about, we also need to be talking about the enabling frameworks that make those actions possible, governance and financing and so on. The fourth pillar of action is about the adoption of formal, comprehensive urban health strategies at both city and national levels. Any action for urban health can be made more strategic if you incorporate the principles that I've talked about above. But a formal strategy takes this further. It creates a single compelling mechanism to bring all the efforts together, to clarify roles and responsibilities, to show political commitment, and to coordinate action. These are 2 examples that we showcase in the guide, one's from Cape Town, the other from Coimbra, Portugal. Now, we emphasize both national and city levels because both are essential. City governments are closest to the issues, they're directly responsible for implementation, and they're most accountable to stakeholders. But national governments control laws and budgets and infrastructure and large-scale policy frameworks. The best outcomes for urban health are likely where city and national plans are aligned and reinforce one another. So the key is that we have to think of urban health action as not just happening at the city level. Now, strategic action depends on strategic insights. And data and decision support, as you've seen above, are 2 of the means of implementation that the guide will cover. I just want to touch on them very briefly because I think my colleagues today will go into much more concrete depth on innovative approaches to data and evidence. Again, this draws on the policy brief on data we published last year. You can find it here through this code. Now, to make strategic decisions, authorities need data not just on health determinants and outcomes, but on a wide range of other factors. They need it at multiple scales, disaggregated to allow for meaningful diagnosis and targeted action, and they need it to be available and ready to use at all times. Unfortunately, comprehensive data like this for urban health is rare. So the guide recommends expanding the coverage, types, and sources of urban health data. We need more spatial and social data, especially on slums and informal settlements. We need more data on cross-sectoral processes and impacts, including co-benefits for other sectors, co-harms too. We need data on stakeholders and policies and governance, data from novel sources, data from partners with special capacities and access, like citizen mapping initiatives, which have been so successful in some contexts. Second, the guide emphasizes adopting data management best practices, so clarifying roles and responsibilities, making sure that data are accessible, findable, usable, and so on and so forth, and protecting against harmful uses. And it calls for adopting a set of urban health indicators, which is not just any available variables, but a coherent set that validly represents the local state of urban health and the functioning of policy and practice. Obviously, having good data is essential, but it's not enough. We also need the capacities and mechanisms to translate it into evidence and the systems to absorb and act on that evidence. Here, the guide recommends institutionalizing evidence-based action, for example, by mandating health impact assessment for planning and development projects, supporting cross-cutting insights, for example, by promoting transdisciplinary research, building local capacity and linking to external expertise, which could mean developing partnerships with universities or establishing urban health observatories, and implementing robust monitoring and evaluation for programs, policies, and interventions. Now, this is just a quick run through of what's in the guide. There will be more information. The guide's now being finalized. It'll soon, within the next few months, be published. Once it's released, the next step will be implementation, and WHO will be looking for city and national level partners in all regions to help make that happen. We're developing a practical implementation protocol to support governments in this process. This would incorporate 4 components: a statement of commitment, a situational analysis, a local action plan, and a needs assessment, which would be developed in parallel so they can inform and strengthen one another. This is not the only pathway to a successful strategic framework or to an urban health strategy, but we hope that the protocol will be useful for actors that are looking for a place to start. So we look forward to finding partners for this work, including perhaps, and I hope, some of you, and I will leave it at that. So thank you very much.
Wonderful. Thank you so much, Jose. As soon as that is available, we can also share via our networks just to help gain a little bit more of exposure. So thank you so much. We're going to pass on to Lambert, who will be speaking. We'll be zoning in onto the African continent now. Thanks, Lambert.
Thank you very much, Emmy, and I hope I can be heard just by a nod. That should be sufficient. Yes, I follow up from what Jose just presented because it provides quite a good overview, and I'm coming into this from a research perspective, trying to make use of data that is already available, having visibility of what is there, and then trying to see what could be how it could be made use of. And so this is work in progress and has not been finalized yet, and there's lots of room for input as to how what directions this could take. And so there is a working direction here that just as Jose mentioned, a sort of an African urban systems observatory, and that if this work of mapping existing data or cataloging data for urban health, if it gets through, this is where it leads us to, if we could get an observatory that helps track and maintain these data for urban health measurements. So again, not to repeat, the urbanization problem that Jose has mentioned is real in Africa, and we are not taking any. We need to put all hands on the table to help solve this problem. And some of the problems related to data are still the same as Jose has mentioned. They are not integrated in many ways. The detailed spatial data are not available in many circumstances, and all sorts of problems that we have seen with data, trying to use the available data. And there's a general saying that if we don't measure, or if we don't know if something is measured, we're less likely to get something done about it. And so this just emphasizes the importance of us trying to do this work. I'd like to indicate that, of course, this is not new in a sense that cataloging data for urban health initiative doesn't exist. We have global sources that are useful from the WHO's Global Health Observatory that will have thematic areas on urban health following up from work that Jose and the team are doing. We have Integrated African Health Observatory that also has mostly national level data that are also very useful. Population data, Africa Police that mentions and try to structure cities in Africa, giving a glimpse of what urban areas are and some of the missed ones that are commonly missed. And UN Habitat is doing lots of work around networking urban data observatories, all which are acknowledged. And the problem, especially from a user's perspective, having cross-setting view, wanting to say what is happening in this context, becomes quite vivid in the sense that maybe if we look at what UN Habitat is doing, we can see a number of the hubs, the urban health data hubs that could focus on different specific issues, maybe slum-related problems or culture-related problems in urban areas, and then bringing this at a higher level to speak about track urban health problems in Africa can be challenging. And so that is why this thought of cataloging again with the idea to see what is there and how it supports this initiative, or if there is a way to bring the existing initiatives to feed into data that can help better track indicators, agreed indicators in whatever way, urban health in Africa. So the idea here is to build a detailed, resolved catalog that links health system to health outcomes and supporting same goals that urban health initiatives have had elsewhere, be it UN Habitat, be it WHO, improve decision-making and feeding as part of the strategic system. Be interested in integrating multiple urban sectors, be built environment, transport environment, and social conditions. So all of these are in the thinking process of how we approach an urban health, African Urban System Observatory that could help improve influence urban health. Now, a few areas that we focused on while trying to pull this data together have been some of the ones that shine out when this work is coming through is the built environment, what data are there in the housing, infrastructure, and sanitation. There's the transport and mobility, what is happening in different countries or different cities in terms of public transit, road safety, active travel as key as some of the indicators, environmental health, air quality, green space, waste management, and for health outcomes, more or less traditional ones as a starting point, but these are always up for improvement or reconsideration. So NCDs, infectious diseases, mental health, and healthcare access as the key indicators that we wanted to focus on while developing this catalog. And the data sources that we've been exploring, we've started with very broader data sources and then narrowing down. So some of the broader ones, we look at what data sources are informing populations, because we need to know what the population is for each setting. And there are different sources of this that we've picked and highlighted at a high level. The AfriPOP, the demographic health surveys that make use of this, national census, where these have not been integrated in other platforms. We also look at spatial and environmental data through OpenStreetMaps. There is the Africa Police that provides quite detailed urban boundaries, satellite imageries, and others that we've listed. And then we have mobility mostly, which is quite data that is lacking in many respects. We're looking at city level data from different sets of surveys that can be pulled from, being it travel surveys, be it time use surveys. We also look at accident data, be it from hospitals, be it from police records. And then for for health, direct health outcomes, we pulling still from the World Health Organization, what they're having just at the high level at this stage, what the DHIS2 is having in a more aggregated way, if it can be provided locally, and then the HDSS, the health and demographic survey systems, what data they are having and they are able to share. And key mention here is the SAPRIN, which has a huge network of this, as well as the in-depth that have been providing that are key sources of data to leverage on for urban health. We zoomed down to 2 cities as a pilot to start looking at how we could make this happen before zooming out. So Nairobi and Accra, because just 2 extremes of Africa in terms of positioning, nothing else, and they have their own distinctions in their own ways, and they also illustrate diversity in its own ways, as well as possibilities of scalability. But this is just to also go where there is some data where previous initiatives and efforts identify these data so that we could begin pulling them together and then making sense and directing us to where we want to, how we want to carry this forward. Like, for example, in Nairobi, there is this in-depth core data set that was released in 2017 around that details slum demographics and health data and then there's lots of infrastructure challenges in this setting, water, sanitation, and mobility. And then there is health outcomes that we could pull from this setting. And in Accra, key thing standing out is air pollution data that Clean Air Fund does produce, but then there are also data around mobility that we could pull from household surveys and from time use surveys that we could. There's an emerging issue about e-waste hotspot that could be spotted, and these are some of the things that when looking at the detailed cities, we start drawing there. So the idea behind this is if we could catalog these data from high level and continuously zoom down and down to city, get high spatial city level resolution data, we could provide a visualization which is interactive, user-friendly for both researchers, policymakers, and urban planners, and to look at different exposures and health outcomes. And this is not something new. The initiatives exist around dashboards, integrating data, and they are just widely available, even for urban health data. And this is the kind of thing that we want to do with this data that we are looking at. At this point, because we are looking at getting more of a time shot, and we're not looking long-term in terms of a sustainable platform, strategic partnership is quite critical, because continuous measurement would depend or will benefit from support from long-term partners, be it the UN Habitat or the WHO Urban Health Initiative variants of it now, and other forms that can host this data locally and track it over time. But what we are interested in now is just getting the cross-sectional view, dashboard interactive, and then hoping that strategic partnerships can take this up forward. And this would also look at local partners, global partners that can come in, as well as community and civic engagement to make this last beyond one time thing. So we're looking at in the next steps to make sure that our platform is fully functional and can give a time shot up to 2025 with integrated data for visualizations across the indicators that we've selected. The indicators themselves, again, just to mention, came from handpicking across various indicators that other agencies have used. We want to think about expanding this data collection and partnerships with relevant stakeholders, and keep pilot testing, feedback, and refinement of these as next steps that we want to carry out in 2025 to fulfill the data gap that we see in the urban health sector. The role as potential impact, not need to mention anymore, that this fits clearly into the strategic framework of providing data, which leads to shaping urban health policy. It empowers local decision makers in many ways, and supporting sustainable and equitable development in Africa. The ongoing work is supported by the Cambridge Africa Alborada Research Fund in terms of cataloging this data. And as I said, it's work in progress to be concluded soon. And at this point, we are very much interested in people who hold data, who have reflected about the problem differently, and how to bring these together so that what we end up outputting can be useful to a wide set of stakeholders. So I think questions would be at the very end, and I would stop there for now. Thank you very much. I pass it on to Christelle and Group.
Thanks, Lavin. Go ahead, Christelle. You're welcome to go ahead. In the meantime, I just want to say, if you do have any questions or thoughts, please do feel free to pop them in the chat. And then at the end of the webinar, once the presentations have been done, we can use those as sort of the core founding discussion points. So yeah, just to remind you. All right, over to you, Christelle. Thank you.
Okay, you can see my screen, right? Great. So I'm so happy to be here with familiar faces, familiar names in the chat. So I'm Christelle, I'm an urban planner and an architect, and I'm going to be also talking with Aminata and Pap Suleiman, our team from Senegal. I'm going to bring the broader lens of why urban data are important for building healthy cities. And then we'll jump into a more specific case of the young game changers, where young people are driving healthier cities themselves in their own neighborhoods and environment. I think this has been brought up a lot by Jose and Lambert. We all know that urbanization is quite important and presents a lot of threat. At UN Habitat, we are the agency that promotes sustainable towns and cities, and we coordinate the overall UN system approach for urbanization. We're the custodian of SDG 11 on cities and communities. These are just snapshots of how built environment actually can induce more diseases in our cities. The facts that Jose mentioned in his first slide are quite repeated here. It's a well-known, I think, reality by now by everyone. But urbanization can also be seen as an opportunity. As planners, as city shapers, as mayors, we have a big role to play on making sure that cities become the immunity, cities become the vaccine, cities become the prevention for health. And many cities of 2030 are yet to be built. So we're not looking at just the existing and making sure the existing is healthy, which is what we need to do. But the reality is that a lot of cities are yet to be built. And in Africa and Asia, this is where it's going to take place. A lot of cities in Africa are going to be hosting more between 5 to 10 million inhabitants. So there is a lot to think about when it comes to infrastructure. Will it be able to support all the people that is there? Will it be able to cater for everyone? And we're not just talking about hospitals in terms of infrastructure. We're talking about actually the city, the built environment, the sanitation, the design of the city, the housing, the quality of the house, the mobility, the transport. And so, as Jose was mentioning, it's like a chess game and it has a lot of things. And so where do we start? What's my next move? Where do I begin? Everything is connected and we need to connect those data. So whether it's from green spaces, housing, as I mentioned, and so on, these are all like everyday factors that we need to keep in mind as city shapers. And understanding this like interconnectivity of this kind of diagram might feel complex, but I'm gonna try to dissect it slowly in this presentation and show you some kind of example so we can understand how we can take small steps into making that happen. So if we take the example of, for example, the waste management. Waste management is a big issue, especially in African continent, where there's informal dumping. And sometimes we dump, it's not about just having dustbins and we think, oh, it's great, but where is this waste going? Is it going into our rivers where we're swimming? Is it going to our water where we're using for agriculture? Is it going to our built environment? And this, I mean, I'm not gonna go through the diseases that it produces, but I think we all are familiar with some of the foodborne disease, the waterborne disease, and others. One of the things we do in order to collect data and understand where waste are going is the WasteWise City tool. It's a tool that has been tested quite a lot of time, especially also in Nairobi and Mombasa. So this is a case study from Mombasa. It helps us understand how is the municipal solid waste is generated, collected, managed in control facilities, but also how much of the waste is not managed. You know, the waste sometimes produce over 30% of air pollution because in a lot of African continent, they resort to burning them. So instead of burning, how can we come up with more innovative approaches on circularity where we can use waste to upscale it and use it again for maybe public space design, place-making activities, and so on. Another kind of factor that I always like to highlight is the noise pollution, because not many people think of it, but also city shapers have a lot to play on when it comes to designing for reduced noise pollution. A lot of our cities are busy with, you know, transport, with industrial noise, with airport facilities nearby our residential areas, which can produce sleep deprivation and anxiety and mood disorders. And what I want to always highlight here is the data that we look at is always spatialized. We're not just looking at data by saying, oh yeah, the data generated by airports and aircrafts are the loudest. No. Where are the airports vis-a-vis the residential areas? Where are the mega transport hubs vis-a-vis where people are, you know, living? So this is where the land use and the job of planners come in hand spatially to understand where they should be locating certain interventions in the area. And for that, we use a lot of like neighborhood walks. We use also perception of noise. We use smartphones like sound meters and decibel sensors to make sure to understand where you know, the cities have higher than 70 decibel level in their cities. Now, the interesting part is when we start adding layers. So we were looking just now at noise and waste alone, but now I want to add in a bit of flavor. So when we think of air quality, usually people think of industries, but I want to now correlate air quality and mobility together. And mobility and transport, but when I say mobility and transport, is like both active mobility and transport things. So if we look at the case of Africa, and we start correlating this information, we know that in Africa, there's the global, the average of people who walk is quite high compared to the global average. So people in Africa tend to walk a lot or to cycle for transport. They at least spend 56 minutes a day to reach their work or to go to markets and so on. So this is quite high. The proximity to public transport is quite high in some of the African cities, but not as high to others. So what does it tell us? It tells us, great, people are walking, amazing physical activity. Well, now let's correlate it with climate condition and air pollution. We put sensors on bikes and we let people go into the streets where they're walking to measure the air quality in those streets. And to our surprise, it shows that a lot of those streets that people are using every day to commute, sorry, that's my iWatch, they are actually very highly polluted. So are we walking to save our life and do like physical activity? Are we walking just out of necessity, or are we walking in like pure highly polluted environment where we're breathing very polluted air quality. Another study in Nairobi has shown that when streets are closed for like placemaking or for like, just like on a Sunday, we close a street for like markets and activities, the level of particles PM2.5 is way lower than in times where there's actually cars in the streets. So this is how like, it's interesting to look at this data, but not just to have it there for nothing. It's like, how do we move it to policies and then from policies move it to action? So this study actually in Africa has led us to come up with the Pan-African Action Plan for Active Mobility. So there's a lot of recommendations there on how we create more safer, more walkable streets in the region. Now I want to move to the green spaces with the temperature. Maybe let's look at those two together. If we look at public space alone, we see that almost in the last 30 years, 30% of public space share has declined globally. So we're losing the lungs of our cities, we're losing those public spaces, real estate is encroaching. So there's also a job for mayors, for us to always spread awareness, not to encroach on those public spaces. In our group, we have this citywide public space assessment tool, which helps us assess public spaces in our cities. Now we look at the case of Nairobi and we assessed 826 public space. Now you tell me, oh my God, that's great, Nairobi has a lot of public spaces. Well, they have a lot, but let's have a deep dive spatially where those public spaces are located. And if you see in the map, 60% of the population of Nairobi lives in informal settlement. And they only have access to 10% of the entire public spaces that are available. So from the 826, they're not actually all available for people who are living in informal settlement, which is actually 60% of the population. So it again tells us that sometimes the wealthier neighborhood have access to those clean, green, safe parks more than the informal settlement and other people who actually need it. So with the data, if I look again at 800, looks great. If I look spatially, it shows me the inequity. So I'm just trying to showcase that, again, the spatial approach to data is very important. Now, let's add another layer of heat. So this is, again, Nairobi with the green coverage and the heat map. And what's interesting here, you would see that the most high temperature neighborhood are actually the informal settlements who lack the public spaces that we saw in the other slide. So it's again about this disparity, this inequity, looking at it. So our intervention will clearly let us know that how can we introduce more cooling strategies in informal settlements? How can we be innovative in creating the right approach to introduce greenery in highly dense area? How can the materials that are used in creating those informal or upgrading those informal settlements can help us cool down and not also have extreme heat indoor and outdoor? Another correlation of data that I want to show is from Jhatni, India, and it's just highlighting the circles, the same neighborhood that I want you to look at. On the left side, we have the public space map, where we're saying in this circle that there's fewer public spaces vis-a-vis the rest. On this one, we have the lack of accessibility. So this is the accessibility to public transport, to whether it's a bus, train, tuk-tuk, and so on. And we have on the right side the population density. So most of the city is living here. This is the most high dense area of the city. Yet it doesn't have public spaces and it doesn't have infrastructure. But if we look at the northern part, where there's not many people living there, we see that there's more infrastructure of transport and there's more public spaces. So again, what does it tell us? It tells us that mayors need also guidance on where they should put their money, where they should put their investment, in which part of the city. Especially in African contexts where municipalities have limited resources, it's not okay to waste resources on areas where it's not serving the population where they live. So from here, what does it tell us when we combine all of this? It tells us that like for you to have a good strategy, you should be correlating those data. You should be putting all the layers above each other for you to be able to know where you should be intervening using like neighborhood, like we have the My Neighborhood Guide, we have the Healthier Cities to Public Space Guideline, where you can come up with the right strategic intervention in your city. It doesn't have to be crazy expensive. It doesn't have to be like super sophisticated. They could be small strategies from greening, from upscaling materials, from ways to introduce like open spaces. It could be very minimal interventions. So again, I just wanted to highlight that integrated approach to urban data and spatialized data. We cannot work anymore with fragmented data when we want to build healthier cities. So when we layer everything, we get the full picture for us to do like the vision of our cities, and most importantly with people. So everything that I've showed you today has been actually gathered by the people that we work with, and by people, it's not just the expert, by the community who are living in those neighborhoods. We do a lot of workshops, whether they are digital, whether they're just like mapping on, like sitting on maps and discussing. And that brings me to the Young Game Changer, which we used everything that I showed you in this project, but with a focus on young people. And the Young Game Changer is in Senegal, Colombia, and India. It really focuses on how young people can be the promoters of health in their cities through public space implementation. It's a project co-implemented also with WHO, and I will give it now to Aminata to give us the rest of the presentation on this one.
Thank you very much, Christelle, and hello everyone. Very nice to have you all in this webinar. So the YGI, the Young Game Changers Initiative, has been divided into 5 working studios. The 5 working studios help us to move step by step towards our main objective, meaning planning and constructing public spaces with the young people. And during these steps, the objective is for them to acquire some knowledge on digital tools, to enhance their employability as well, and also to teach them slowly but surely how they can have a voice into the governance of their city. So the first studio was about what was the citywide assessment. So before being able to plan any public space, we needed to know exactly what is existing in their city. And in the existing public spaces, what issues they have and how are they distributed, how many are they, so that we can know when we narrow down this analysis, we can know exactly where to implement our project. Once we have selected 2 public spaces, we moved forward to the site-specific assessment. For this assessment and for this studio, the young people were able to go to these 2 sites that were selected and to proceed to a long analysis on how these sites are exactly used, what kind of amenities are on the sites, and what are the crucial issues that exist also on these sites and that need to be enhanced or improved. Once we have done this analysis, it was time for the young people, including the Young Game Changers, to proceed to the conception of the public space they want to have in their city. So that's where they were trained to the Minecraft game. And they were able, on this game, to conceive exactly and design the public spaces they wanted to see in their city. After this, they have done these designs, and after they have agreed on one design for each public space, we were able to receive the architectural studio that supports us in translating these Minecraft designs into architectural plans. Once that has been done, now we're moving towards the tactical placemaking, so the actual construction of the public spaces, and then the activation also of the public spaces, because it's not only about building them, but making them active and welcoming for the young people and everyone. Next slide, please. So for this process, we encountered a lot of issues in terms of data, because as you know, in southern, like in the cities of the south, it's very complicated to have data for many reasons, and especially data on young people's needs and behaviors, which are very often neglected, because the national and the regional data sets tend to more focus on children, very young children, and on adults when it comes to employability and things like that. But then this range between children and adulthood is often neglected. After that, we also have encountered issues in terms of availability of data at the city level. And I have seen someone in the comments saying that they have data at the city level, but not at the neighborhood level. So it's complicated to see the difference between the populations. And that's already great because in some contexts, we only have data at the regional or the departmental level and not at the municipal level, or it's very scarce. That was the case for Barney. And then in terms of health, the health data is very often limited to clinical records and not environmental determinants. And these clinical records are not accessible for people like us doing studies because they're submitted to medical confidentiality. So it's very complicated to access them. And finally, we also had structural issues with the municipality that did not have the technical capacity to produce and manage the data, because basically they are working on paper and not using any digital tool, which makes it more complicated to gather the data and to make it accessible at any time. They also have limited institutional capacity because within the 9 departments that constitute the municipality of Barney, each one of them, most of them are understaffed, or the staff that work in these departments are not endowed, like they do not have the accurate, the relevant technical capacities to proceed to their missions and to actually do the work that is expected from them and from the municipality. Also, due to the lack of computers and lack of internet access, they do not have essential tools to proceed to their mission. And finally, financial constraints push the municipality to really select the missions that it can carry on. So some areas, some topics become very less relevant for the municipality to cover. So that is data. They do not have time and sufficient funds to create, produce and manage data. And it also concerns the public spaces, because the main focus for the municipality would be health or supporting financially the families that are the least well off. And then the public spaces are not seen as a priority of action for the municipality. So it doesn't plan much for it, and it doesn't have money set aside for the public space. And so in this context, it was necessary for us to choose the right data gathering tools, because we were also working with young people who sometimes were not very familiar with French or were not very familiar with digital tools. So we needed to find within the toolbox that UN Habitat has, the large toolbox, some tools that were accessible for them, that would resonate with young people, and that would be also effective enough in this context where data is lacking. So that's the tools that we have selected. We also had to think about the scales that we were working on. It wasn't possible to just come select a public space and work on it. We needed to have an overview at the municipality level, at the level of the town, and then after this evaluation, have narrow it down slowly but surely. And during this process, also allow the young people to understand their role into the governance of the city, at the city level, at the neighborhood level, and also at the national level. That's what happened also with the Young Gamechangers initiative in Barney. And I will let now Pap Suleiman give us more details on the different studios we went through. Thank you.
Thanks, Aminata. Thanks, Crystal, for your intervention, and thanks for hosting us today. So I will go more deep dive into what we have done throughout the 5 studios we have with the Young YGI project, starting with the Studio 1, the Citywide Public Space Assessment, which objective was to evaluate the public space at the scale of the city of Bargny in Senegal. So the first challenges that we faced in Bargny was the availability of data, as pointed out by many intervenants. So we did go into Bargny and do an assessment. Then we saw that at the municipal level, there wasn't many data about the existing public spaces. They didn't even know the number of public spaces at the scale of Bargny. So we did use some secondary data from the National Urban Planning agency of Senegal and data over the internet, such as Google Maps and other sources like OpenStreetMap, in order to have a preliminary data. Then this data wasn't so complete, and then we did go onto the field in order to collect more data and then map out the existing 90 public spaces at the scale of Bali. Once the mapping of the 90 public spaces were done, then we had the room in order to seek and collect more data for each of those public spaces. That's the reason why we did use Cover Toolbox. So Cover Toolbox is a digital collection tool that is partly freemium and is easy to set up and use. Also, it can be used online and offline, and it's multi-user. So Cover have many advantages, and that's the reason why we did use it for the data collection. In order to do the data collection, we did have 10 team leaders, mostly constituted of 6 YGI, so the young game changers that are generally aged around 20 years old. And we have also a team of 40 years that are generally aged around 40 years old. So those people, those young people were deployed into the city of Barney in order to collect for each of the public spaces some key question. And this was done 4 times on a weekly basis, morning and evening, in order to have a better and global picture of what was going on for each of the public spaces, be it in the morning or in the evening, be it on the weekend or on weekdays. So the the form we did have with the Cover Toolbox had many questions, like more than 100 questions. Those questions, and some of them was weighted as parameters and used into our final indicators. The final indicators was analyzed using the QGIS software, that is a GIS open source software as well, that is well used. And those indicators are the accessibility, safety, physical component, comfort, and the health and well-being, that is K element. As you can see in the map on the top left, where we have generally all the 90 public spaces, which have a value of moderate generally, and most of them also have bad condition, as you can see, the red ones. So this led us to a vote over the main public spaces based on their values, be it bad, and also the vital function they occupy for the city of Bani. So 5 were pre-selected and submitted to the vote of the population. Because it's a co-creation, the population did vote for 2 final public spaces that are the public spaces of Ngain and Jamalai CFP. Once the voting of the 2 public spaces have been done, we did also do a more granular assessment using a tool that's called Inhabit Place. So with Inhabit Place, we did had more information about the 2 selected public spaces. We did also do the same for the team building using the 14 young people we have and the 10 supervisors constituted by 6 young game changers and 4 focal municipal points. So this is kind of inclusion to have the mayor team in the building and the young people also. The assessment was done also 4 times on weekdays and weekend in order to have a global picture of what's going on those public spaces at a weekly basis. Key indicators also were tracked in there, like the movement people, where did people come from, where did they go, why did they use the public spaces, how time do they pass on each public spaces, how do they see the public spaces, is the public spaces safe for them or not, is the public space welcoming for them or not. And also we have a photojournal to capture each people interaction with the spaces and the feeling they have the time they passing on those public spaces. Like, and this led out to having like more information of what the resident of the public spaces wanted, the young people want, and also the population of Barney that voted for the 2 public spaces. All this information was used, and young people were trained with Minecraft. Minecraft is a digital gaming platform that was used in order to modelize the current 2 public spaces. So 2 exercises have been done. First, to modelize how the public spaces looks like actually in Barney, the public space of Ngain and Jamal Asefi that was voted and selected by the population. And another exercise was to modelize how them as young want the spaces to look like in the future, taking into account the data collection we have done throughout Cover Toolbox, throughout Inhabit Place, and also all the data they have gathered from the population and the residents' needs. slide. This led out to the architectural studio where a cabinet of an architectural cabinet came into Barney in order to teach young people about basic principles of architecture, so that they can understand more how design could impact safety, well-being of the two public spaces. And by doing so, also young people have been to the market and local suppliers in order to know for each of the elements they want to build or they want to put into those two public spaces, how much does this cost? Because we have a limited budget. In order to take this all into account, we had for each element of the public spaces, the prices that were collected by young people. Also, we did explore some element like shaded one, and they impact on health and also the use of elderly. This led out to a strong discussion about like the maintenance and on the long-term basis that is generally like not taken into account when we talk about public spaces, and maintenance is a key element. And this led out also to the last exercise we have done, that is the participatory budgeting exercise that were done in Barney. So we did use what the people want, the residents, using the field data also. We created a digital platform that mixed out the Minecraft design we had in the field data collection we have done in order to have this platform where people could access and vote for what they want for the public spaces based on the limited budget we have. And for each of the elements to be built, a health tag were made possible, like with the help of WHO and UN Habitat. So you see for the boat, for the pilot, you see the health tag and the descriptive element. Each population can see it and vote depending on what you want, be it trees, be it solar lamp, be it the pilot that represent the cultural perspective of Bali. And also they were trained on the public participatory budgeting so that they can do the exercises. And we did held in-field voting and iftar voting also, because the period of voting coincided with the Ramadan period. So many people in Bali gathered into one place and voted for the two public spaces. Also, the young people did go over the schools, over the markets, over the surrounding neighborhoods of Bali in order to have the maximum people vote. Also, the minimized people have been counted into account, like the handicapped one also did vote. So it was inclusive as much possible. And right now we are moving toward making the placemaking. So the architectural master plan are to be ready soon, and we will build those two public spaces taking into account the data we have gathered, the Minecraft design here we did have, and all the young people motivation want and the population want. Then globally we can resume that. We did use a lot of digital collection tools toward the 5 studio we had. So first we did use Cover Toolbox in order to gather data about the 90 public spaces and assess them, and then Quizzes in order to analyze and do the selection before submitting the vote to the population, which decided the 2 of them to be used. Then afterward, we did use Inhabit Place in order to have more granular data for those 2 public spaces before going Minecraft in order to modelize block by block how the public spaces look like actually, how it will look like in the future, based on what the residents want, what the young people want, and also what the population of Bali wants. And also we are in the last phase aiming toward building those 2 public spaces. Thank you all.
Thank you so much. That is a very fantastic summary, I think, of the incredible work that you've been doing on the ground. I think all of us can be very inspired by the very creative approaches to collecting data that your team has taken, and really been working so closely with young people on the ground. So thank you very much for that fascinating presentation, as well as Christelle for giving us that wonderful overview of UN Habitat's work and the importance of data there. I think we can go to some of the questions and comments that have been coming through the chat. I might direct them to some of the presenters, but I think a couple of them are linked around some of the challenges that we do experience with data, urban health relevant data on the continent. So thank you, Natasha, for popping in. Levels of disaggregation of data. I do see your comment in the chat says one of the issues with data is the spatial granularity. Often data are only available at the city level, which prevents the understanding of differences between populations within a city. So I don't know, Lambert, I know you've been looking possibly, I don't know if you've been very familiar with a lot of the data across Africa just yet. Through your research, but just wanted to find out, have you had and come across a lot of these challenges, and how are you sort of going about some of the challenges that you're facing with different data sets, sort of disaggregating to different levels, and maybe just give a couple of examples of what you've seen?
Yes, Amy, thanks. I think it is common to have data at city level. But again, it is still the data that are at city level are still also very sparse. So you have a few cities with city level data, then you might go more to national or regional levels. That's where you even have more data across African settings. But then city level data are relatively common in some areas, as we mentioned, when the surveys are generally designed to, or data generally designed to be collected to fit to some city purpose, maybe be it some time use survey to see how a city is behaving, or travel survey, or be it injury data. The city is that unit that is easily considered so far. But then disaggregating these to neighborhood levels, I think this is something that is just coming up now. A few initiatives that I could see using spatial level disaggregating for specific interests, be it slums or neighborhoods, to capture food environments, travel environments with some spatial granularity. Those efforts are popping up now, but I think the whole the tradition has been trying to capture city level data, but then the importance of neighborhood is quite important now. Maybe Christelle wants to say something on that.
Yeah, I hear spatial and I feel like I need to come in.
Yes.
So no, I think you're right, Lambert, but also there's a lot of information sometimes at city level, but it's not maintained and up to date. My problem with data gathering sometimes is like, okay, we have a project or we have something that we want to do, so we gather the data, and then there's no one actually keep updating those data and keeping the maintenance, So I think there's also need for cities to think a bit more innovatively, use maybe AI, smart cities tool to keep like those data generated automatically through maybe a system that they can create for things that are more on the spatial, like imagery, aerial imagery analysis, and so on, for some aspect of spatial data analysis. At the neighborhood level, it's always like tricky when you zoom in. For us, what has always played a good approach to get those data is always doing like rapid planning studios, where we convene in a space in the city and we really like set on maps and we really like map together and put not just the quantitative data of on the map, but also the perception data as well, because it's as important as the quantitative one. So I just wanted to flag that.
Thanks, Christelle. That's really helpful. As a related question in the chat, I do see we have another question coming through, so I'll just jump to this one. But Erica, thank you for your question. What is the best way to encourage researchers to collect data in African cities that are less represented in the overall urban health literature? Or do you think this needs to be the responsibility of public officials and workers? Or is this somewhere is this somewhere where private data collection could play a role? And maybe, I mean, I could open the conversation through some of our research at the African Center for Cities, where we do collect information on a range of African cities through our African Mayoral Leadership Initiative. And some of our challenges with some of the city data is rife, but also the cities have a lot of their own estimates, knowing some of the limitations around national census data. Some of the cities have even gone and collected their own forms of data using drones and satellite imaging, and it's almost like they have a really good handle on some of the estimates themselves. But I think researchers can play a role. It probably won't be as extensive as something like a national census, but I mean, of course, there can be opportunities for partnership. I think that's the biggest thing is actual collaboration between researchers and governments to help collect data and information. I don't know if anyone else wants to jump in there with a thought or maybe an example of where they've seen this type of thing work with researchers joining in partnership with government, or government just doing some really great work in getting some more data sources. I'll just see if anyone pops their hand up. Lambert, there we go.
I think it's important to look at the broader picture, that data collection is important, and that's what we've been talking. Then there is another dimension of what data is important. When you ask about a researcher driving initiatives to collect data that they need, or government or private partnership, these data collection are driven for different reasons. But then there is one thing, is the value of the new information, because sometimes if a drone would just pick up some estimates and they are reasonable enough, then should we push for new data collection? So this is another dimension that I think it stands on its own. Is data is important, yes, but how valuable is the data? So not just collecting, but collecting data that is valuable. And who defines the value of the data that comes in is another question, because some data comes in and at the tail end where it's supposed to change the outcome. If data, for instance, about exposure on air pollution, just if we have an input data that just changes the outcome by maybe 2 deaths, so we get a very good spatial resolution of air pollution, and then at the outcome level, we see, oh, well, with the new data we've gotten, we've changed the estimate of health outcome by a death of 2. Does that make any difference to the policymakers because of the new data? So this is just another dimension to add to who collects data, is the value of the new data coming in. Back to Jose.
Yeah, I would just respond that I think that there's absolutely a role for researchers in collecting data, and I would point to an initiative in Latin America. Actually, the Salurbal project has developed intra-urban data on hundreds of variables for, I think, 370 cities across the whole continent, the whole region. And I think there's potential certainly for replicating that kind of work in Africa through the kinds of remote sensing approaches that I just put in the chat, but also working with governments. I think often the partnerships between researchers and governments are some of the most productive ways to generate new data, because the researchers bring certain skills and capacities to that equation, and the governments bring the reach and authority to operationalize that. So absolutely, there's a role.
Thanks so much, Jose. We just have someone in the meeting room who's also got a possible question that they would like to ask. So Jonathan, I'm just going to see if you are able to unmute.
Yes.
Can we hear you? Okay, great.
Sure. Thank you, our moderator, for the opportunity, and also special thanks to the panel for the insightful presentation. And especially I would like to acknowledge Christine and Tate for highlighting Nairobi new examples, because I deeply relate to these specific findings from the data collection. So my first question is directed to Jose. And have you established specific implementation targets and timelines to measure the success of the strategy? And then to any of the panelists regarding data dissemination, do you share this information with local communities to help them make informed decisions? For instance, waste disposal and air pollution, or is it preliminaries shared with the policy makers and decision makers only? Thank you.
Thanks, Jonathan. So just to answer that question directly, no, we haven't specified targets and timelines, in part because implementation plan strategies have to be contextualized. So they will be different from place to place. We can't give a universal strategy and apply it to all cities. It won't work. I think that just to say, first of all, I really, really enjoyed all the other presentations. They really illustrate the complexity of these challenges and the sort of vibrant innovation that's going on in Africa. We heard a lot about determinants and outcomes. I would just add that there's this other layer of data that I talked about that needs to be added in. You need to think about, if you want to make a decision about waste management, who needs to take that decision? Is it the sanitation department? Is it public health department? Is it the planning department? Is it the mayor's office? Do all of them have to be involved? How does that work? Are there mechanisms to allow that to happen? How long does it take? How long does it take for a law versus a regulation versus a guideline versus a standard versus a project? All of those have different implications. And how does the timing of each of those processes relate to the timing of disease causation? How does it relate to the timing of budget cycles and electoral cycles, right? All of those things have really dramatic impacts on the patterns that you see. And we're not measuring those things in any sort of systematic way. So when you think about timelines and targets, they have to take those sorts of things into account. What is the process by which you're going to achieve solutions? And how does that work? Because, and I saw another, I'm sorry, I'm talking a lot, but I saw another question in the chat there. How do you move from intent to action? And I mentioned that when I was talking. Intent is great, it's not enough, right? Sometimes the way that the systems are structured for governance or data or innovation or other things just aren't conducive to actually implementing the things that that you need to implement and that everybody wants to implement. So we need to be looking at those processes and structures as well.
Go ahead, Christelle.
Yeah, no, I like what Jose was mentioning, who's doing what. So this kind of like urban governance understanding is very important. I'll give you the case of, so I come from Lebanon, and in Lebanon, the beachfront is managed by the national government, while the roads and the city one is managed by the local government. So one of the challenges in my city is like the pollution at the coastal area, but the government, the mayor is not able to do anything because he always needs approval at the national level. But as citizens who are living in the city, we always blame the mayor, but actually it's not the mayor's fault, it's the national ministry level's fault. So it's also understanding, okay, who's doing what, but letting the citizens know and be aware how the built environment is functioning and managed by whom. Otherwise, you risk to have also bad intention on a mayor who's trying to do whatever he can. He just simply cannot because the governance doesn't work to his benefit. And another thing I wanted to also mention on the researchers, I think now we're moving to, in Habitat, our mandate is really focusing on housing, and we're trying to do the housing enhanced kind of updated guideline together with WHO and so on. We're seeing a lot of like conflicting sometimes messaging from research that have, for example, looked at tuberculosis, and then you have ventilation recommendation, for example, for an opening of your house, etc. And then you have another recommendation from another research that maybe talks about, I don't know, malaria or dengue or whatever, or even asthma in the space, and it tells you about different measurements of openings. So this different researchers are doing different things. It's just like it's conflicting when you're trying to do the built environment. Who am I trusting which research? So I think it's also like important to get the data, important to get the researchers, but there's someone who needs to put this all together for less confusing recommendations for city shapers.
Thanks, Christelle. That's really helpful reflections. And on your first point, I think, one of the things that I've seen in my own work is that even sometimes when a particular country has claimed to decentralize certain powers and functions to a local government around, for example, waste management, it actually doesn't always mean that the local government has full responsibility and power, because they might be on the wrong political party. And there's a lot of these dynamics and politics at play that can even contribute to some of the complexities around how much local governments can actually do in some of the responsibilities that they are supposed to be having. So I think it's really helpful to understand local context, understand what actually changes even between cycles of governance systems. But this is all very helpful reflections. Yeah, thank you. I've just seen, is there someone else who has a question in the chat? From your research, are there social accountability initiatives to empower communities to champion for urban health through designs and such? Njambi, I just wanted to double check, who are you targeting that to? Anyone in particular? Just wanted to see if you had targeted, otherwise we can see if we can answer collectively. Christelle, are you able to answer that question? From your research, are there any social accountability initiatives to empower communities to champion for urban health through designs?
I think the process that Aminata just mentioned, when we have this digitalized platform that are transparent for all the citizens to see, and also like hold the cities accountable to what they're doing, I think the whole process of the YGI in Senegal is one example of how you can empower communities to be the champion of urban health. We've done a lot of capacity building together. WHO came to Senegal. They actually gave a lot of training and advocacy and outreach support to the city to make them understand why, as a community member, I need to be advocating for this, and what's my role, in not polluting the environment and not like putting waste on the street, and making sure the environment is maintained, and doing more physical activity and holding my city accountable. And the participatory budgeting is a very important point that Aminata mentioned and Pap Suleiman, because the participatory budgeting has raised awareness of the municipal budget. So young people were also understanding the taxation that I'm putting in, where is it going? Where is this money going, to which intervention? And this is where they can have, their mayors accountable, because they can see, okay, this is the municipal budgeting, this is how much I'm putting money, I'm not seeing anything done. So you can actually have more awareness not to elect them the next time, or if they do have an intervention, then follow up is actually this intervention what I need, what I express that I want. We all as citizens said we want to have more public spaces, but we're seeing the mayor is more interested in I don't know, private housing, real estate. So is he actually matching the budget to the needs of the community? So I think those platforms, transparency, awareness, capacity, they all are tools to empower communities to be more aware of and become like kind of the champions of urban health in their city.
Thanks, Christelle. Aminata, I see your physical hand.
Yeah, I'm sorry. I have been looking for the hand raising thing, but I haven't seen it. And I do completely agree with what Christelle was saying. And beyond that, I think even in the process, it's not only about initiatives specifically for accountability, like to enhance the accountability of the municipality, for example. Even the process of our activities sometimes give us the opportunity to confront both of them. For example, when we have focus groups or workshops where we invite representatives of the municipality and some people from local NGOs or the population, they get to have some conversations that they do not have on a daily basis. I just wanted to insist on the fact that we shouldn't maybe only focus on the project specifically targeted for that, but try to insert the aspects of accountability in all the small activities that we also do within any kind of project or any kind of initiative. Thank you.
Thank you so much. We've just got time for one more question, and then I think we can wrap up. Jose, there's just a question around, have you established specific implementation targets and timelines to help measure the success of the strategy? I don't know if you are able to answer that now.
So I think I answered that one already. That no, because it's contextualized. I can't give specific targets or timelines for that would be universal.
Perfect. No, that's
Although
fine.
we will have timelines for the protocol that I mentioned. We're thinking that's probably a 4 to 6 month process, but that's still a development.
Perfect. Well, thank you, everyone. I think this is the end of our webinar, so really appreciate all your engagements, but thank you again to the panelists for your wonderful presentations and for taking the time to prepare and present to us. I think we can all agree that this was very helpful in understanding just a little bit more about the topic, so just really appreciate your time. Thank you, everyone. Great. Thanks. Bye.
Thank
Bye,
you.
everyone.
Bye.
Thank you. Bye-bye.